Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss what are CPTSD symptoms, what is CPTSD, complex post-traumatic stress disorder, commonly known as CPTSD, occurs when someone has dealt with long-term trauma. This means the trauma happened over a long period or covered repeated events. Examples might include being a soldier during war or a prisoner of any type in war, in a concentration camp, and in cases of human trafficking. Child physical or sexual abuse, which can go on for many years, is another example of complex trauma that could result in CPTSD, as is being in an abusive relationship as an adult. Usually, the events leading to CPTSD involve a symbolic or actual captivity. The victim is under the control of another and is unable to escape the situation quickly. Physical symptoms of CPTSD. Symptoms can manifest with a wide range of physical symptoms, often due to the chronic stress and emotional dysregulation associated with the condition. Some common physical symptoms may include sleep disturbances, insomnia, nightmares, or disrupted sleep patterns. Stomach pains. Gastrointestinal issues include irritable bowel syndrome, IBS, digestive problems, and stomach aches. Chronic pain, muscular tension, headaches, or unexplained physical pain. Fatigue. Feeling constantly drained and tired. Autoimmune disorders. An increased risk of autoimmune conditions due to the impact of chronic stress on the immune system. Cardiovascular problems. Elevated blood pressure and an increased risk of heart disease. Weight changes. Fluctuations in weight, often due to stress-induced changes in appetite. Sexual dysfunction, such as changes in libido or difficulties with intimacy. Neurological symptoms, cognitive difficulties, memory problems, and difficulty concentrating. Sensory hypersensitivity, heightened sensitivity to noise, light, touch, or other sensory stimuli. These physical symptoms can vary widely among individuals with CPTSD, and not everyone will experience all of them. In depth, look at BPNID versus CPTSD versus complex. PTSD can sometimes be misdiagnosed or confused because they share overlapping symptoms such as mood swings, relationship difficulties, and emotional dysregulation. Several factors contribute to the potential for borderline versus CPTSD misdiagnosis. Overlap in CPTSD versus borderline personality disorder. Symptoms: CPTSD, BPD conditions involve emotional instability, impulsivity, and issues with self-identity and self-worth, making it challenging to differentiate them based solely on symptoms. A comorbidity. It's common for individuals to have both CPTSD and BPD. Further complicating diagnosis, they can co-occur, making it challenging to identify the primary diagnosis. Trauma history. Trauma is a common factor in both conditions. BPD may develop as a response to childhood trauma, while CPTSD specifically relates to prolonged or repeated trauma. Trauma histories can be complex and challenging to unravel. Stigma. There may be stigma associated with both diagnoses, leading to reluctance to seek or provide an accurate diagnosis. To minimize misdiagnosis, mental health professionals must conduct a thorough assessment, consider the individual's trauma history, and use validated assessment tools. Moreover, ongoing communication and collaboration between the individual and their healthcare team can help refine the diagnosis if needed. It's essential for individuals seeking help to be open and honest about their symptoms and experiences to ensure an accurate diagnosis and appropriate treatment plan. Complex PTSD criteria. The complex PTSD definition does not have distinct diagnostic criteria in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Still, it is often considered a variant of PTSD with additional features related to prolonged and repeated trauma. Here's a simplified list of some of the standard features associated with C-PTSD, meaning and diagnosis: exposure to prolonged or repeated trauma. C-PTSD typically arises from chronic or repetitive traumatic experiences, often interpersonal, disturbances in self-identity. Individuals with C-PTSD may have a fragmented or unstable sense of self, low self-esteem, or a feeling of emptiness, affect dysregulation. Emotions can be intense, overwhelming, and challenging to manage, leading to mood swings and emotional reactivity. Impaired relationships. Difficulty in forming and maintaining healthy relationships, including problems with trust, boundaries, and intimacy. Negative self-perception. Persistent feelings of guilt, shame, or worthlessness are common in CPTSD. Alterations in consciousness. This can include dissociation, depersonalization, or amnesia, where individuals may feel disconnected from their body or surroundings. Somatization. Physical symptoms of stress and trauma, such as chronic pain or gastrointestinal issues, may be persistent symptoms. CPTSD symptoms often endure and may become chronic if left untreated. As PTSD and interpersonal relationships. How do CPTSD and dissociation affect relationships? Difficulty trusting others. Feeling unsafe, using drugs, alcohol, or behaviors to numb anxiety or distress. Avoiding friends, loved ones, or activities you used to enjoy. Recovering from a CPTSD episode and addiction is often challenging to go through alone. Many people experience relapses during withdrawal in an attempt to alleviate symptoms and satisfy cravings. However, you can manage withdrawal symptoms and successfully recover with detox and rehab therapy and a robust support system at the We Level Up New Jersey Treatment Center. If you require assistance with your rehab journey, contact a We Level Up New Jersey treatment professional now. Your call is free and confidential. That's it for today. Please subscribe and hit the notification bell. Like, share, and comment. We would love your feedback. Have a great day.